In this lecture, we are going to discuss testosterone. We will discuss in detail what is testosterone, what are the different functions of the testosterone, and the different disorders related to the testosterone. So, without wasting time, let's get started. First of all, we will see what is testosterone. Testosterone is a steroid hormone. It is actually produced from the cholesterol, and the testosterone lies in the androgen class of hormone. But the important thing, whenever we listen the word testosterone, the first thing that comes in our mind is male. Male produces the testosterone, but it is not true. Female can also produce the testosterone as well. But male produces testosterone in the testes, and the female produces the testosterone from the ovaries. But another important thing, adrenal gland that lies over the kidney. So adrenal gland present in both male and female. So from the adrenal gland, testosterone can also be produced in the male and the female as well. So main source will be testes in case of male and ovaries in case of female. But the quantity of the testosterone will be high in the male as compared to the female. Next, how testosterone secretion regulate inside your body. So it is actually regulated by your brain. Your brain will control the secretion of the testosterone inside your body. But how? So first thing, and the most important part of the brain, that is hypothalamus. From the hypothalamus, there is a hormone produced by it, and that is gonadotropin releasing hormone. This hormone will stimulate the gland that is also present inside your brain, and that is pituitary gland. Pituitary gland will produce two hormones, LH, which is also known as luteinizing hormone, and second is the FSH, follicle stimulating hormone. LH, luteinizing hormone, will stimulate the Leydig cells that are present in the testes to produce the testosterone. So LH will stimulate the Leydig cell, and ultimately you will see the productions of the testosterone. But the FSH will help in the spermatogenesis, productions of the sperms. So that is the important thing. Two hormone, LH, which involve in the productions of the testosterone from the testes, and the FSH, which is involved in the regulation of the spermatogenesis, sperm production process inside the testes. Next, we will see how testosterone transports in the blood. There are three main pathways through which the testosterone is transported through the blood. First is the sex hormone binding globulin. Testosterone can bind to this globulin, that is a protein, and transport to the different part of the body. Second is the testosterone can also bind to another protein, that is albumin. And third method is the free testosterone. But the important thing which you have to remember, these two binding testosterone will be inactive. They will not perform their functions. But free testosterone obviously will produce its function. So that is the important thing regarding the testosterone. Next, we will see the different functions of the testosterone. So we have categorized the functions of the testosterone according to the different stages of life. So first thing is the fetal life. What does it do in the fetal life? So basically in the fetal life, it promotes the development of the external genitalia like penis, and the testes will be developed with the help of the testosterone produced inside the fetus. So development will be regulated by this hormone. If this hormone is deficient, then there will be disturbance in the development of the male genitalia like the testes and the penis. And at the puberty, with the passage of the time, when the man uh, uh, enters into the puberty phase, then what will happen? First of all, the size of the testes and the penis starts increasing. due to the testosterone. Testosterone will also influences its effects on the testes and the penis. Deep voice. Basically, development of the genitalia is the primary sexual characteristic, but the second is the in the puberty phase. Deep voice will be seen in the male at the puberty. Second is the facial and the body hairs. Hair growth on the chest, under the armpits, in the groin regions, and on the face. All these characteristics are the male secondary sexual characteristics. And second is the increase in the muscle mass. Will also be done with the help of this hormone, that is the testosterone. Next is the spermatogenesis. Spermatogenesis, productions of the sperm, that is also be regulated by your testosterone, that promotes the productions of the sperms inside the testes. So these are the different functions which you will see at the puberty. And what about when the man enters into the adult phase? So in the adult phase, it maintains the libido. Sexual desire will be maintained by the testosterone. When testosterone level starts decreasing, then the sexual desire will also be decreased in that case. And you can also see the erectile function. Erection of the penis will also be controlled by the testosterone. Low level of testosterone, you can see the erectile dysfunction problems in that case. You can also see sperm production will also be regulated by the testosterone, as we have already discussed in the spermatogenesis. And you can also see the muscle mass increment. You can also see the bone density will be maintained by the testosterone. And RBC's production will be regulated by the testosterone. So all these functions will be done by your hormone, that is testosterone. And another important thing, testosterone further converted into two hormones. Testosterone converts into the dihydrotestosterone, that is the most potent form of the testosterone, with the help of the enzyme, that is 5-alpha reductase. And second is the testosterone converts into the estradiol with the help of the aromatase enzyme. So dihydrotestosterone, what is the function of DHT? So DHT actually promote the growth of the prostate gland that lies beneath the urinary bladder. You can also see the male pattern baldness will also be due to the DHT. So DHT actually attack on the hair follicles, and as a result, male will see the baldness problem in that case. Genitalia development will also be done by the DHT. That is the most potent form of the testosterone. Estradiol will involve in the bone maturation and epiphyseal closure. At the end of the bones, cartilage will start converting into the bone, and that will also be due to the estradiol. So estradiol basically involved in the growth of the bone. Okay, next we will see the different disorders in case of hypogonadism, low level of testosterone, and hypergonadism. So when the level of the testosterone start decreasing, then what will you see in that case? You will see the decreased libido. Sexual desire starts decreasing in that person. You can also see the erectile dysfunction. Penis will not erect properly due to the low level of the testosterone. Infertility. That person cannot produce the babies as normal one due to the low level of testosterone. When there is low level of the testosterone, then obviously there is a problem in the production of this sperm. When there is a problem in these sperms, then it will not ultimately get fertilized with the egg, and there will be the no development of the baby or the conceivement in the female. Muscle mass start decreasing, and gynecomastia increase chest, and it will start looking like the female, that is gynecomastia. In hypergonadism, you will see the high level of testosterone. You can see the acne on the face, and aggressive behavior will be seen in that male, and infertility will also be seen in that case. So in both hyper and hypo condition, you can see the infertility. Androgen insensitivity syndrome, in that case, testosterone produced, but it will not work as it has to do, and that is the androgen insensitivity syndrome. But that person will start looking like a female due to the androgen testosterone insensitivity. Next, normal range male will be 300 to 1000 nanogram per deciliter, and in female you will see the 15 to 70 nanogram per deciliter. So male testosterone level in the male will be high as compared to the female. And not important thing, testosterone level will be high in the early morning, that is the important thing. And with the passage of the time, in the old people you will see the testosterone level start decreasing, and it can commonly be seen after the 30 age. Next is the anabolic steroids. People who do gym will start using the anabolic steroids to build their muscles, because testosterone builds muscle mass. But if someone take artificially or through the medicated anabolic steroids to get more muscle mass, in that case there is another side effect, and that is testicular atrophy. The size of this testis start decreasing, and ultimately that person can go towards the infertility. So there are the different cases seen in the bodybuilders who use the anabolic steroids to get their muscles big size. So that is another important problem seen in that case. So this is all about the testosterone. If you still have any question, you may ask in the comment section. Thank you so much.